lot about saving our health care through an expanded health savings account program. As you might know, those have existed since, I think, 2004 or 5. Yet, as I travel around and talk to people, maybe 1 in 10 people have a clue what that is. And it's already they've been around for 10 or 12 years. What would you do to get that information out and get people to move that direction?
Okay, the question for those who couldn't hear is about health savings accounts, which I actually think is the way to go. What we would do is provide a health savings account for everybody starting the day that they are born. They will keep it until the day they die. We pay for it with the same dollars that we pay for traditional insurance. The difference with a health savings account is that you have control over it. And so your interaction is with the healthcare provider directly without a third party involved. Now, the Affordable Care Act does have a little section on health savings accounts. That is a very little section, and it's to restrict them because they realize that that would be too much competition for them. And what you can do that really is glorious with these, and maybe a little twist that's different from your traditional HSA, is you give people flexibility within their health savings account. So that, let's say that dad is $500 short for a particular scan, his wife can give it to him out of hers, or his daughter, or his cousin, or his uncle, or anybody in the family. It gives you enormous flexibility to deal with things. More than 80% of all your encounters would easily be taken care of through your health savings account. It also makes all your family members very interested in your health. Because if you're smoking like a chimney, they're going to say, hey, you stop, man, because you might be affecting me too. But also, remember, since almost everything is coming out of your health savings account, the cost of your catastrophic insurance drops dramatically. It goes way down. Sort of like a homeowner's policy with a big deduction. Big deductible. It's a much different animal than a homeowner's policy where you want every scratch taken care of. And now the logical question is, I understand how that would work for the majority of people. But what about for the indigent? And what about for the people who don't have a job, who don't have any mechanism to fund their health savings account? What do you do with them? Well, the logical answer is, what do we do with them now? How do they get taken care of now? Medicaid. What's the annual Medicaid budget? Over $400 billion a year. How many people participate? About a quarter of our population, 80 million people. 80 million into 400 billion goes 5,000 times. $5,000 for every man, woman, and child in Medicaid on average. Now, what could you buy with that? Concierge or boutique practice costs generally about $2,000 to $3,000 a year. So we give them all a concierge practice, and you still have thousands left over to buy catastrophic insurance, which of course is much cheaper now. Now, I'm not suggesting that that's what you do, but I'm saying that's how much money we're already allocating. So what if we learn how to allocate that money effectively? And we give those people a health savings account just like everybody else would have one. Here's what would happen. When Mr. Smith gets a diabetic foot ulcer, instead of going to the emergency room, he would go to the clinic, where it costs 1/5 of what the emergency room costs, because now he's interested in preserving money in his health savings account. He wouldn't have been otherwise. They would patch him up in either the emergency room or the clinic. But the emergency room sends you out. The clinic says, let's get your diabetes under control so you're not back here in 3 weeks with another problem. That's where you really start to save a lot of money. If the phlebotomy is $16 at this clinic and $66 at this clinic right now, he don't care which one he goes to. He'd care a whole lot about which one he went to then. That's how you begin to really preserve money and foster a sense of personal responsibility. Because see, that is a goal of any programs that the government sponsors I think, should be to foster personal responsibility in the populace, to reinstill the can-do attitude and to get rid of the what can you do for me attitude.